Talking now here on the KingStoyota.com hotline. First off, Professor, welcome to the program.
Hi, good afternoon.
Professor Daniel Healy, Professor of Pharmacy at the College of Pharmacy at UC. And Professor, what we're talking about is this young gal, just to kind of update on people who maybe not be familiar with this. Amy Copeland is the young girl's name. A couple of weeks ago, more or less, she was riding a homemade zip line, which right there is not a good idea, I would think. When the line snapped, she fell, cut her calf open, ends up in she fell into the water of this river they were at. She was taken to the hospital. I guess it was a pretty good-sized gash, 22 staples, more or less stitches. But in the process, gets this bacteria into the wound, and as a result, has already lost a leg, part of her abdomen, and is probably going to lose her fingers as a result of this. Professor, why so antibiotics don't work?
Well, it's not that they don't work. There are a number of antibiotics that will actually treat some of these organisms that cause this necrotizing fasciitis or some of the subcutaneous tissues that are involved in this infection. But the problem is how rapidly the infection actually progresses. So just within a few hours, these bacteria can rapidly multiply, and they produce toxins which kill a lot of the normal healthy tissue. And as a result, they also choke off the blood supply to the downstream tissue, and that's in fact why amputation is sometimes necessary. So these organisms can progress very rapidly. They're very invasive, and I think in this young lady, I would suspect that the size of the wound, when they said 22 staples, that's a sizable wound. And the deeper the wound, the more likely to have organisms that get deep in there that can't be cleaned out by normal techniques. And I think that's part of the problem here. So it's not really that antimicrobial agents won't work, but by the time you get a patient to the intensive care unit, when you start administering antibiotics, it's sometimes a little late.
Doctor, this girl's in critical condition. Is she going to make it?
I have no idea.
I mean, do people die from this flesh-eating disease? Didn't Oprah have this before?
I have no idea. The numbers are pretty grim. Certainly there's only a few cases each year in the United States. So of all the people who get skin infections, most of them are mild and superficial and are easily managed, usually on an outpatient basis. Only 750 reports of this type of flesh-eating infection occurs each year in the United States. So it's not very common.
Well, let me ask you this: what are our chances? Let's say me, Trace, and Randy, we want to go down to the Ohio River or the Little Miami or something and do a little canoeing.
Sure.
And you know,
not a very good swimmer.
And Randy likes to drink a bottled beer, and so we break a bottle accidentally. Well, it falls on my leg, and I slit open my calf, and I fall into the water. What are my chances of getting something like this?
I don't know, 750 out of many million. It would be very uncommon.
So this poor unfortunate girl, I mean, more or less.
Yeah, was it the doctor that didn't clean it up in the first place?
That's what I would. Yeah.
No, it's not that so much as that by the time she was able to get proper, the medical care where they could actually...
I'm sorry to interrupt, Professor, but I'm guessing that the last thing somebody's going to think about in an emergency room, if this thing multiplies as quickly as you're talking, is going, oh my God, she's got flesh-eating disease.
Well, I don't... Well, by the time they establish that, it's usually, you're working from behind. So, again, you can do everything perfectly correct, but because of the time factor involved, patients tend not to do too well. The mortality rate with these types of infections can approach 50%. So give or take, and it sort of depends on other underlying factors. But
is it extremely painful, doctor?
Sure, it can be very painful, and that's one of the tip-offs. Pain and a number of other signs and symptoms. The rapidly progressive nature from something that starts out as being not too bad or severe looking, and then progressing over a period of just minutes to hours. So if it's rapidly progressing in the wrong direction, certainly you have to get to emergency care.
Professor Dan Healy, we appreciate you talking to us.
Okay, thanks for having me.
Thank you. And it just
Bye now.
sounds like nasty business there, doesn't it?